as long as it's a low-risk pregnancy and there aren't any reasons that the mother-to-be would have to be seeing a specialist, then really there's no reason that they couldn't stay with their family doctor to have their baby delivered. So typically I'll be seeing a woman and her partner and family before they get pregnant, and we'll often talk about things that they want to make sure that they're thinking about before getting pregnant, the best times to try to get pregnant, making sure they're on a prenatal vitamin beforehand, making sure that they know what kinds of medications they can and can't take in pregnancy and when they're trying to conceive. And then we usually see them quite early on after they know that they're pregnant, and then I follow people, seeing them approximately every 4 weeks until they're about 28 or 30 weeks of pregnancy, and then after that about every 2 weeks until about 35 or 36 weeks, and then I'll see them every week until they deliver. And then usually if there's a vaginal delivery, women will go home 24 hours after they deliver, as long as everything's going well for them and their newborn. We'll see them in the office usually within 2 to 3 days after they deliver, just to make sure that the breastfeeding's going well, that the baby's doing well and gaining weight appropriately. Well, I think one of the benefits of having a family doctor who does low-risk obstetrics is that you really get comprehensive care throughout the preconception planning, throughout the pregnancy, in the hospital, and then when you go home. So it's much more it's a more seamless experience, I think, because the person who's taking care of you is taking care of you throughout each step of the way, rather than having to transfer your care out to another facility or another specialist and then come back. Pregnancy is one event in a woman's life and in a family's life, and it's an incredibly important event, but there are implications, medical implications of things that can happen in pregnancy that have farther reaching effects for the woman's health down the road. So, you know, if a woman develops diabetes in pregnancy, that has implications for her risks of developing diabetes down the road. And it's nice if the family doctor is a part of that process from beginning to end, because then they know that history, and that history may inform their health care going forward. So I think that's one of the benefits of having a family doctor who does low-risk obstetrics be involved in the care throughout. We're really a part of supporting labor and the pregnancy experience as something that's a part of life, and it's a natural process, and we like to support that in its entirety whenever possible. But we also obviously have obstetricians, specialists, pediatricians, anesthetists that are on call 24/7. So if something changes and it moves from being a low-risk situation to a higher risk situation, we can always consult, and we have that at our fingertips without actually having to remove us from the spectrum of care. So we remain actively involved, and I think that helps with the continuity of care. And I think it helps. I think it helps women and their families if their primary provider is able to be there in that capacity. It's the people. So even when we were in the older facility that was a little bit less modern and maybe certainly a little bit less glamorous than the new side, than Our Lady of Mercy, St. Joe's for me has always been my community hospital. I trained in a community hospital, and I trained in a smaller community, and I think that it's the people that make a building. So you can have a gorgeous building, but if it's not filled with people with passion and compassion, then I think that the people really outweigh the facility. And now that we have the new building, I think that the facility has risen to meet the heart of the people behind it. Yeah, so I think the rooms are great. I mean, they're massive. They have beautiful windows in them, so it's really nice for families. I think it makes a huge difference for the women's support person that's there, because it used to be that we had these chairs that didn't go really flat and they didn't all consistently work well, and now we've got these really great options for the husband or partner that's there with the woman in labor, so they can actually get a little bit of rest, because second to the person that's in labor, they're the most important person in the room, really. And so I think that's really nice. They're much more comfortable rooms, and there's and the postpartum rooms are really lovely as well. So I think it's, you know, the beautiful grounds around the fact that we're really almost right at main level makes a big difference, because I think you get to benefit from the greenery around the hospital, and it's not a concrete jungle here, and I think the grounds around St. Joe's are really lovely actually, and there's beautiful homes in the area, so it just makes it, I think it just fleshes out the community feel of the whole experience. Prepare for the unexpected, I guess I would say. I think that it's really a great idea to have a loose birth plan in place, but I think it's also really important to be flexible, that things can change throughout and it may not be exactly what you planned, but that the staff that are here will be able to support you through whatever happens in the delivery process.